بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. This lecture is about three important infectious diseases. These are the measles, mumps, and rubella. Measles, mumps, rubella are infectious RNA viral illnesses, and these viruses characterized by one serotype. Humans are the only natural host. There is no animal reservoir, and there is no vectors for these viruses. Measles virus, mumps virus, and rubella virus, all of these three viruses are single-stranded RNA viruses. Single-stranded RNA viruses, and it is a lipid enveloped in both measles and rubella, and lipoprotein enveloped in mumps. The measles virus and the mumps virus are belong to the family Paramyxoviridae family, while the rubella virus belong to a family Tagaviridae family. These are from the virological point of view. Regarding the portal of entry, all these three diseases, measles, mumps, rubella, acquired through a respiratory system by contact with the infected air droplets. So the measles enter through the respiratory tract by the contact with the respiratory infected air droplets, and the mumps from person to person contact with the respiratory droplets, and the rubella transmitted by the also infected respiratory droplets. In addition to that, measles can be acquired through the conjunctiva by contact with the infected air droplets, and the rubella can be transmitted from the mother, from the infected mother to her fetus through the placenta, i.e. there is a vertical transmission in a case of rubella, causing what is called congenital rubella. Regarding the incubation period, it is the period from the entrance of the virus till the appearance of the signs and symptoms. It is about 8 to 12 days in a case of measles, and about 16 to 18 days in both mumps and rubella, but it ranges from 14 to 21 days in a case of rubella, and range from 12 to 25 days in a case of mumps. The other important thing is the infectivity period, i.e. the period in which the patient is infectious to the others, i.e. he can or she can transmit the disease to the others. In a case of measles, the infectivity period is about 3 days before and 4 to 6 days after the onset of the rash, which is the hallmark of the measles. In a case of mumps, the infectivity period is about 7 days before and 7 days after the parotid swelling, which is the hallmark of the mumps. In a case of rubella, the infectivity period is 5 days before and 6 days after the appearance of the rash, and maybe up to 14 days. But in congenital rubella, it may be prolonged up to 1 year after birth. So there's a shading of the virus in the nasopharyngeal secretions and the urine of a congenital rubella baby. So this is a very important, the infectivity period, in which the patient can transmit the disease to the others, and it ranges from 5 days before and 4 to 6 days after the onset of the rash in a case of measles. In the mumps, it is 7 days before and 7 days after the parotid swelling, the onset of the parotid swelling, and in a case of rubella, it is 5 days before and 6 days after the appearance of the rash, while in the congenital rubella, it may be longer than 1 year after birth. These diseases, measles, mumps, rubella, usually affecting those who are not immunized, or those who are malnourished, or those who are suffering from immune compromise, whether it is congenital or acquired, or those who are in contact with an index case. So these groups are vulnerable to developing the measles, mumps, rubella. Epidemiology regarding measles. Measles remain endemic in regions of the world where measles vaccine is not readily available. It is most common in the developing countries, and it is responsible for about 20 million infections and about 150,000 deaths annually. Infants acquired immunity transplacental from the mothers who have had measles or measles immunization, and this immunity complete for about 4 to 6 weeks of the life, but then it starts to decrease, and it is generally undetectable in infant after 9 months of age, but some protection may persist that may interfere with the immunization administered before 12 months of age. Regarding mumps, the peak age of occurrence is 5 to 9 years of age, and in a case of rubella, rubella was most common in preschool and school age children, but after the introduction of the vaccine, the incidence of the rubella decreasing by more than 99%, and most cases are among those who are more than 19 years of age. Transplacental antibody is protective during the first 6 to 12 months of life. Also similar to that in a case of mumps, the passive immunity can protect the infant in the first 6 to 12 months of life. The incidence of the measles, mumps, rubella decline after the introduction of the MMR vaccine. Measles pathogenesis. The essential lesion of measles is found in the skin, conjunctiva, and the mucous membrane of the nasopharynx, bronchi, and the intestinal tract. The characteristic histological finding is the presence of a large multinucleated giant cells called Warthin-Finkeldy giant cells, and these are pathognomonic for measles. Viruses is present in the respiratory secretions, blood, and urine of infected individual. During incubation period, measles virus migrate to the regional lymph nodes. Clinical manifestations. Measles has 4 clinical stages. These are incubation period, prodromal stage, Xantimatus stage, and the recovery phase. Number 1, incubation period. It is the period between the entrance of the virus till the appearance of the signs and symptoms of the measles, and as I said, it is about 8 to 12 days. While the second stage is the prodromal stage. The manifestations of the 5 to 3 days prodromal period are cough, coryza, conjunctivitis, and the pathognomonic enanthem called Koplik spots. They are first appear as a discrete red lesions with bluish whitish spots in the center on the inner aspect of the cheeks at the level of the premolar. They may spread to involve the lips, hard palate, and gingiva. Also may occur in the conjunctival folds and in the vaginal mucosa. This enanthem, Koplik spot, is a transient, lasts for about 12 to 24 hours, and it appears 1 to 4 days prior the onset of the rash. So when you suspect a case of measles before the onset of the rash, so you have to look for the presence of the Koplik spots in the inner aspect of the cheeks. It reported in about 50 to 70% of the cases of measles, but it may occur in a great majority of these cases. The conjunctiva may reveal a characteristic transverse line of inflammation along the eyelid margin. It's called Stimson line. This picture shows the Koplik spots in the inner aspect of the cheeks and the buccal mucosa. The third stage is the Xantimatus stage, the rash phase. It is often accompanied by high-grade fever reaching about 40 degrees centigrade, and the characteristic maculopapular rash, which is begin around the forehead, around the hairline, behind the ears, and on the upper neck, and spread over the most of the body within 24 hours in a descending fashion, i.e. from upward to downward. It is often confluent, and the rash fade over about 7 days in the same manner, i.e. from up to down, and as the rash fades, it undergoes brownish discoloration and desquamation. The severity of the illness is correlated with the extent of the rash, and it may be petechial rash or hemorrhagic rash in severe cases, which is called black measles. Also, the patient may have cervical lymphadenitis, splenomegaly, mesenteric lymphadenopathy with abdominal pain. Also, the patient may develop otitis media, pneumonia, and diarrhea, and these are more common in infants, while liver involvement is more common in adults. This is a picture showing a small child with measles. Looks to the maculopapular rash, extensive maculopapular rash, which is confluent rash associated with the virulent conjunctivitis, and the patient looks ill and toxic. Modified measles is a term used to describe mild cases of measles, which occurring in person with partial protection against measles. So, modified measles may develop in person vaccinated before 12 months of age, or vaccinated with the co-administration of the immune serum globulin. Also, it may develop in infants with the transplacental acquired antibodies, or in person receiving immunoglobulins. Persons with the inapparent or subclinical measles do not shed measles viruses, so not transmitted the infection to the household contact. This is important. Differential diagnosis of measles. You have to differentiate measles from any case presented with fever and rash, like in rubella, rosella, enteroviral infection, adenoviral infection, infectious mononucleosis, toxoplasmosis, meningococcemia, scarlet fever, rickettsial diseases, Kawasaki disease, serum sickness, and even from drug rash. Clinical features of mumps. About 40% of the cases of mumps are asymptomatic. Other cases may have prodromal period of fever, headache, malaise, and muscular pain. Pain and or swelling of one or both parotid glands, which is the hallmark of the disease. 70% it will be bilateral. Ear pain on the ipsilateral side. As swelling progress, i.e. parotid swelling progress, the angle of the jaw is obscured, and the earlobe may be lifted upward and outward. Ingestion of sour foods or liquids may enhance pain in the parotid area. The opening of the Stenson duct may be red and edematous. The parotid swelling peaks in approximately 3 days and then gradually subside over 7 days. Fever resolves in 3 to 5 days, along with the other systemic manifestations. Morbilliform rash is rarely seen in a case of mumps. Submandibular salivary glands may be also involved, or may be enlarged without parotid swelling. Edema over the sternum due to the lymphatic obstruction may also occur. Clinical manifestations of rubella. rubella also it is called German measles or 3-day measles. There may be a mild catarrhal symptoms of prodromal phase of rubella, and this catarrhal stage may goes unnoticed. While the characteristic signs of rubella are the retroauricular, occipital, and posterior cervical lymphadenopathy associated with erythematous maculopapular secret rash. The rash begins on the face and spread to the body and lasts for about 3 days, so it is called 3-day measles. The rash is less extensive than that in measles. An enanthem consisting of a rose-colored spots on the soft palate, known as Forchheimer spots, develop in about 20% of the patient and may appear before the onset of the rash. Other manifestations of rubella include mild pharyngitis, conjunctivitis, anorexia, headache, malaise, low-grade fever. Polyarthritis, usually of the hands, may occur especially among older women, but usually resolve without sequelae. Paresthesia and tendinitis may occur. Clinical manifestations of congenital rubella syndrome. This is very important. Congenital rubella syndrome may involve all the systems of the newborn baby, causing different types of pathology. The most important one is the cardiovascular system. It can cause congenital heart disease, especially the patent ductus arteriosus. In the central nervous system, there will be microcephaly, parenchymal necrosis, vasculitis with calcification. In the eyes, there will be a cataract, congenital cataract, microphthalmia, glaucoma also may develop. In the ear, there will may be a cochlear hemorrhage. In the lungs, there will be interstitial pneumonia. In the liver, there may be a giant cell transformation with the fibrosis and bile stasis. In the kidneys, the patient may develop interstitial nephritis. In the bones, there will be malformed osteoid and thinning of the cartilage. In the spleen and the lymph node, there will be extramedullary hematopoiesis. And in the skin, there may be an erythropoiesis in the dermis. So these are the clinical manifestations of a congenital rubella syndrome. And the most important is the PDA in the cardiovascular system, microcephaly in the CNS, and the cataract in the eyes. This is a newborn baby with congenital rubella syndrome. So don't forget the microcephaly, PDA, the heart, and the cataract. Diagnosis. How to diagnose these 3 diseases? These are viral diseases and usually diagnosed on a clinical basis and rarely confirmed by serology or viral culture may be required. But usually the diagnosis is a clinical diagnosis of these 3 viral diseases: measles, mumps, rubella. Management of these viral diseases: the patient may require supportive measures like antibiotic and encouraging the oral intake. Prevention of spread is very important, so the patient should be isolated, and the children should avoid school and daycare centers until no longer infectious. Immunization is a very important, or the most important step in the prevention of the disease. Measles vaccine given at the age of 9 months, and the measles, mumps, rubella vaccines, MMR vaccine given at the age of 15 months, with the second dose at 4 to 6 years age. Treatment of measles. As I said, measles is a viral disease, so there is no specific treatment for this disease, for the measles. Routine supportive care, including maintaining adequate hydration and antibiotic required. For patients with the respiratory tract involvement, airway humidification and supplemental oxygen may be of benefit. Respiratory failure due to the development of a croup or pneumonia may require ventilatory support. Photophobia is intensified by strong light, which should be avoided. Intravenous ribavirin may be beneficial in severe infections in special situations. The most important thing is the regimen of the vitamin A supplementation. In a case of measles, vitamin A therapy is indicated for all patients with the measles. So, all patients with the measles should be supplemented with the vitamin A. And the vitamin A should be administered once daily for 2 days at the dose of, according to the age group, 200,000 international unit for children 12 months of age or older, and 100,000 international unit for infant from 6 to 11 months of age, and 50,000 international unit for infant less than 5 months of age. In children with the signs and symptoms of vitamin A deficiency, a third age-appropriate dose is recommended 2 to 4 weeks after the second dose. The regimen of the vitamin A supplementation in a case of measles is very important, and 2 doses should be given once daily, and the dose is according to the age group. But if the patient having a sign and symptoms of vitamin A deficiency, a third dose should be given 2 to 4 weeks after the second dose, also according to the age group. Complications of these viral illnesses. Complications of measles could be common or rare. The common complications of measles including the otitis media, pneumonia, activation of a latent tuberculosis, and diarrhea. While the rare complications regarding measles including the myocarditis, mesenteric lymphadenitis, encephalomyelitis, which occur in about 1 to 3 in each 1,000 cases, about 2 to 5 days after the onset of the rash. Subacute sclerosing panencephalitis also is a rare complication. It develops in 1 in each million of cases of measles, and usually develop about 7 to 10 years after the initial attacks of the measles. Complications of the mumps. The patient with the mumps might be complicated by viral meningitis, about 10% of the cases. Encephalitis, 1 in each 5,000 case of mumps. Orchitis, more commonly affecting the adults, or ophiritis in the females. Pancreatitis and deafness also may be noticed as a complications of mumps. Rubella, complications are erythropathy, it's common, encephalitis, thrombocytopenia, and myocarditis might develop in a case of rubella. Congenital rubella syndrome, 75 to 90% transmitted during the first trimester. About the prognosis, measles, the mortality rate has been fallen, and most of the mortality due to the measles are due to the pneumonia or diarrhea, especially in the developing countries. But generally the mortality has been declined due to the advancement in the care, in the health care, and the management and the supportive measures. Also, encephalitis has a 15% mortality. Encephalitis that complicating the measles have a 15% mortality and result in seizures, and may result in seizures, deafness, hemiplegia, and severe learning difficulties in those who are surviving. Subacute sclerosing panencephalitis is a severe illness that may rarely affect children about 7 to 10 years after the initial illness. Prognosis of mumps, the disease is usually self-limiting and has a good prognosis. Prognosis of rubella. Rubella is not a debilitating disease in adult, while in congenital rubella syndrome may cause developmental delay, hearing impairment, congenital heart disease, neurological, ophthalmological, and endocrinological complications might occur in a case of congenital rubella syndrome. Notification of measles, mumps, and rubella are essential, is mandatory. These three viral diseases are notifiable diseases. So don't forget to notify these diseases for the health director. And thank you for listening.